In this morning's Health Watch, possible changes in the government's health insurance programs. A new proposal would cut reimbursement rates for doctors who accept Medicare by 30% in 2012. Consumer correspondent Susan Koeppen reports the potential cuts are raising concerns for the more than 100 million Americans who rely on the program, as well as the doctors who treat them.
People are dying because they don't have simple access.
For more than 30 years, Dr. David Ansel has been treating patients who can't get help anywhere else.
I've always taken patients regardless of their ability to pay.
He says he's seeing a growing number of patients with Medicaid or Medicare who just can't find physicians willing to treat them.
Come on in.
He says the main problem is the government's low reimbursement rates.
I don't fault the doctors, I fault the system.
One study in Colorado found that a doctor earning $100 through private insurance would be paid about $71 through Medicare and only about $50 through Medicaid.
Doctors just want to see patients, but they also want to be paid fairly.
His patient, 64-year-old Wallace Harris, came to him when he had nowhere else to turn.
Some specialists, they just refuse to accept my Medicaid card.
Some would consider Harris a hero. He was shot while trying to help a woman who was being attacked.
Take a deep breath.
I've worked over 50 years in this country, and I paid taxes, so why shouldn't I have some kind of benefit when I need it?
And it's not just Medicaid. 73-year-old retired school teacher Jean Callahan thought being on Medicare meant she would be protected.
Medicare is our insurance. For people to reject it, I felt stymied. I just felt helpless.
We wanted to find out how widespread the problem is.
Hi, I'm interested in making an appointment.
So we called 40 primary care physicians at random across the country.
Would you accept United Healthcare?
95% told us they accept new patients with private insurance.
Do you accept Medicare patients?
And most, 78%, still accept Medicare patients.
You don't accept Medicaid?
But only 13% said they would see patients on Medicaid.
These results don't surprise me at all.
Ron Pollock is the executive director of Families USA, an advocacy group for healthcare consumers.
Clearly, we have a real crisis right now with respect to Medicaid.
But healthcare providers on the front lines, like Dr. Ansel, are concerned that with more cuts on the horizon, the crisis could spread.
The first baby boomer hits 65 this year. There's going to be 78 million baby boomers, and they are going to come flooding into this healthcare system, and we ain't seen nothing yet.
Susan Koeppen, CBS News, New York.
A first-of-its-kind study released just last week found Medicaid benefits the people who receive it not only physically but also emotionally as well as financially.